The gluteus medius and gluteus minimus also assist in lateral rotation of the hip. So gluteus medius and gluteus minimus. The most important muscle of the lateral rotator group is the piriformis. Originates on the anterior surface of the sacrum between the anterior sacral foramina. Then travels right across to insert into the greater trochanter of the femur. And that's supplied by the piriformis, nerve to piriformis, S1 to S2. The obturator internus muscle goes from the obturator membrane over to the greater trochanter, quadratus femoris below it, to the neck of the femur, superior and inferior gemellus. Crucial about the piriformis is that it goes through the greater sciatic foramen here. So remember that it's inserted into the greater trochanter, origin is the sacrum, supplied by the inferior gluteal, lateral sacral and superior gluteal arteries, and supplied by the nerve to piriformis, L5, S1 and S2. Another reason for piriformis is important is because it divides the vasculature of the region. Neurovasculature, sorry. The superior gluteal nerve lies above it. This innervates gluteus medius, minimus and the tensor fascia lata. All the other nerves go through the greater sciatic foramen with the piriformis muscle below it. These include the inferior gluteal nerve to gluteus maximus, the sciatic nerve, which is the largest nerve below the piriformis. The sciatic nerve has articular branches to the hip joint and muscular branches to the flexors of the knee, which are hamstrings, and then all muscles in the leg and foot. So it's a very crucial nerve for the lower limb. And the pudendal nerve. Irritation of the piriformis muscle, such as in the case of a herniated disc, can also irritate the sciatic nerve, because it runs right underneath it, causing symptoms in the leg and rest of the lower limb. The internal iliac artery divides here into the superior and inferior gluteal arteries, which mirror the nerves. The surface anatomy of the gluteal region is divided up by a vertical line running from the palpable highest point on the iliac crest and running downwards to the level of the ischial tuberosity, and then a horizontal line running forwards from the also palpable posterior inferior iliac spine. Most of the piriformis and the sciatic nerve then lie in the lower medial quadrant. The pieces is readily palpable because of the skin dimple that is the marker of just above it, just at the top of it, with the iliac crest being palpable on most patients. The sciatic nerve exits the gluteal region midway between the greater trochanter of the femur and the ischial tuberosity, which is the lowest part of the hip bone. The safe area for injections, then, gluteal intramuscular injections, is the upper left quadrant here. Upper lateral quadrant, sorry, because it's furthest away from the sciatic nerve. To do this precisely, place the index finger on the acis and the middle finger onto the iliac tuberosity. The region between these two fingers marks the safe area for injection. You want to inject into gluteus medius, not maximus. Injections into the sciatic nerve will leave the patient with a burning, tingling sensation down the entire limb, potentially causing paralysis of the entire leg and foot. Such as drop foot, where the foot hangs limply at the ankle. The thigh is divided into a anterior compartment, posterior, and medial. The posterior compartment of the thigh contains the hamstrings, extensors of the hip, and flexors of the knee. These are semimembranosus, semitendinosus, and biceps femoris. Now all of these attach to the ischial tuberosity, which remember is here. The ischial tuberosity is here, at the posterior of the hip bone, this being the posterior compartment. One head of the biceps femoris attaches to the short head attaches to the femoris, attaches to the lateral surface of the shaft of the femur here. And that's the only one that doesn't attach completely to the ischial tuberosity. Now they're all supplied by the tibial nerve, which is a branch of the sciatic nerve, and they're supplied with blood from the perforating arteries, which are in this region, branches of the profunda femoris. Usually there are 3 or 4 perforating arteries. So all of these muscles originate at the ischial tuberosity. The semitendinosus goes into the proximal shaft of the tibia. The semimembranosus into the medial shaft of the tibia, and the biceps femoris down as far as the fibula and into the lateral tibial condyle. So as I've said, the sciatic nerve is a continuation of the sacral plexus, deriving from between L4 and S3, leaving the pelvis through the greater sciatic foramen, which it shares with the piriformis muscle, going underneath the piriformis muscle, runs inferiorly underneath the gluteus maximus muscle. Now the sciatic nerve is talked of as a nerve, but it's actually a combination of the common fibular and tibial nerves, which split into 2, somewhere behind the biceps femoris. The tibial nerve runs down through the popliteal fossa and goes on to supply the posterior compartment of the leg, whilst the common fibula goes to the anterior compartment and lateral compartments. The posterior cutaneous nerve of the thigh also exits the greater sciatic foramen below the piriformis muscle, like everything apart from the superior gluteal nerve, and innervates the skin of the posterior surface of the thigh and the leg, as well as the skin of the perineum.